Hello and welcome to Bloodborne Pathogens, the initial training for Gaston County Schools. OSHA, or the Occupational Safety and Health Administration, is the federal government's answer, the federal agency charged with making sure your work environment is safe and healthy. In the late 80s and early 1990s, bloodborne diseases were in the headlines all over the United States. HIV in particular is what was really going on. The disease was out there, people were afraid. They knew that somehow it was transmitted by blood and body fluids, but there was so much panic that we had to make workplaces a safe place to be. OSHA went about adopting some standards to ensure that workplace safety. The final standard was adopted in September of '92, and this mandated an implementation of a training. It was the responsibility of the employer to protect their employees from occupational exposure to blood or body fluids that contain blood. Implementing the standard is not optional. All local education agencies are considered employers and have the responsibility of protecting their employees while they're on the job. Gaston County Schools, like all of the others, has an exposure control plan in place, and the purpose of that standard is to make sure you're safe while you go about your day. It is to limit or eliminate on-the-job exposure to blood and potentially infectious body fluids that could result in the transmission of bloodborne pathogens that would lead to disease and or death. The complete exposure control plan can be found in the Gaston County Schools Bloodborne Pathogens Manual. It's your responsibility as the employee to locate the manual at your particular school. You can find it in lots of different places. I can almost guarantee you can find it in any of your nurses' offices. Your front office should also have a copy, and additionally there's a digital copy available on the Gaston County Schools website underneath the Health Services tab. Now, the responsibility of the employer, or Gaston County Schools, are dictated by the standard. They include knowing and recognizing the hazards and hazardous conditions, implementing this mandatory standard, notifying employees of what OSHA is and how the standard applies to them, providing protective equipment at no charge to the employee, educating all at-risk employees, which your initial training is part of that. You'll be doing this initial training, and after today, you won't have to ever sit for initial training again. You'll be given an annual review at your particular schools. Providing medical exams when required, and defining safe, standard operating procedures. Providing the hepatitis B immunization, as well as the personal protective equipment at no charge to the employee. You as the employee have responsibilities as well. They're dictated in the standard, and you're supposed to comply with that outlined standard. Follow all health and safety rules. Use the protective equipment that's provided to you. Report any hazardous conditions, promptly reporting any injuries and seeking medical treatment, using your rights responsibly. Now, the way Gaston County Schools has chosen to do their particular plan is they've identified classifications of employees. Classification 1 and 2 employees are jobs in which the task required as part of your job description will either routinely or occasionally bring you into contact with someone else's blood or body fluids. For that classification 1 and 2, training is a requirement, as well as the hepatitis vaccine will be offered. Notice on the chart are some different job descriptions, some classifications that you fall into, and you'll notice that the task that you have to perform will determine what type of protective equipment you'll need. But you'll see on the chart above that there's some job descriptions that would make you classification 1 or classification 2. There's a third classification, classification 3, in which the employees, their job description does not involve exposure to blood or contaminated fluids as part of their usual routine. Any classification 3 employee can decline to perform these tasks without retribution. The OSHA standard does not apply to jobs listed in the classification 3, and they're not offered the initial training or the hepatitis B vaccine. Some of these classifications depicted above, administrators, teachers, teaching assistants in regular classrooms, bus drivers, secretaries. But if you think about it, some of these jobs at any particular school may become classification 1 and 2. For example, a secretary in a small elementary school would be the first line for children to to go to if there's a problem. So they may very well, even though they're not first responders, be the people that come in contact on a regular basis with small children's blood or body fluids. In that case, there's an employee determination questionnaire that will need to be completed. And once that is completed by the administrator, it's turned over to Human Resources. And they may, at that particular school, decide that the secretary would be considered classification 1 or 2. So just because your job is listed in classification 3, if your job description really is that of classification 1 and 2, there is a process to go about changing that. Okay, let's go ahead and get started. The major pathogens we're going to be talking about today are hepatitis B, hepatitis C, and HIV, or human immunodeficiency virus. Now, an infection is just a disease process caused by a pathogen or a germ getting into the body and overpowering the body's defense system. The most common pathogens around are viruses. We're not going to be talking about cold viruses or respiratory viruses today. We'll be talking about blood viruses, hepatitis B, hepatitis C, and HIV. Another common pathogen causing infection is bacteria. Generally, these are the infections like strep throat, like ear infections, that can be treated with antibiotics and essentially cleared or cured from the body. Let's begin the discussion with HIV, or human immunodeficiency virus. HIV attacks the body's defense system, or their immune system, and it leaves your body unable to fight small infections. It doesn't cause infection on its own. It prevents your body from fighting the infections. The symptoms may not be recognizable as HIV positive for up to 10 years and mainly just appear as nonspecific type illnesses. At this point, HIV will eventually progress to AIDS, or acquired immunodeficiency syndrome. This is the syndrome that's a cluster of illnesses that results when your immune system is so damaged. Illnesses that are normally uncomplicated for well people will become life-threatening for HIV-positive individual. If you get strep throat, if you get chicken pox. In a normal, well person, your immune system would do its job and cure itself. In HIV, your immune system is so destroyed that it's not able to get on top of these small, usually mild infections. Now, the symptoms of AIDS include fever, diarrhea, fatigue, night sweats, weight loss. Now, a lot of these are just nonspecific illness, don't feel good type things. But AIDS, again, is that cluster of issues that normally don't present any problems for a well person, but in someone who's HIV positive, whose immune system is destroyed, once this cluster of symptoms gets started, this is what will progress to, or will be fatal for the HIV positive person. Now, HIV is transmitted from getting infected blood into your body. Now, different sources of that transmission includes blood being splashed onto broken skin or mucous membranes being your eyes, your nose, or your mouth, being stuck by a sharp that stuck someone else. What I need you to understand is sharps is not necessarily a needle. Anything that's sharp enough to stick you and draw blood is considered a sharp. So some different things that would be considered sharps would be an accidental needle stick, of course, but also piercings, tattoos, even broken glass, sharp wood. Any of these can be considered sharps because they can draw blood if they stick you. Also through IV drug use, through transfusions of infected blood or blood products. Giving blood does not put you at risk at all, and this blood supply in the United States is safe. During sex, from exposure to infected semen, vaginal fluids, or blood, from an infected mother to her unborn child, or through breastfeeding, and from contact with the amniotic fluid of an infected mother. Now, we know how HIV is transmitted, so we need to prevent the spread of HIV, especially while you're on the job. We know that the blood supply in the United States is safe. Another thing you can do is determine your own personal HIV status. Testing can be done through your private physician, but it's also offered through the Gaston County Health Department. The phone number is 704-853-5006. Testing at the health department is free and confidential. Another way to prevent the spread of HIV is to avoid high-risk behaviors, those being IV drug use or sharing of needles, unsafe sexual practices, practicing abstinence and monogamy are certainly ways to prevent that spread, and while you're on the job, following safe work practices. Now, when we talk about following safe work practices, basically what we're talking about is using universal precautions while you're on the job, as well as using the personal protective equipment that we'll make available to you. The next topic is hepatitis. The term itself simply means inflammation of the liver and doesn't specify what the cause is. Chemical hepatitis is caused by chemicals, meaning alcohol or medications, and viral hepatitis includes hepatitis A, hepatitis B, and hepatitis C. Now, hepatitis A is spread through contaminated food or water. It's usually self-limiting and a much less severe illness than hepatitis B or C. Now, hepatitis B and C are bloodborne viruses. Hepatitis B and hepatitis C are considered chronic illnesses and will usually be more severe and longer-lasting infections. Neither hepatitis B or hepatitis C can be spread through casual contact. So it doesn't matter if someone uses a water fountain or forks or telephones, casual contact will not spread a bloodborne disease. Now you'll notice that the sources of transmission are really basically the same as HIV, and that's because both of hepatitis and HIV are bloodborne illnesses. So sources of transmission include blood being splashed onto broken skin or mucous membranes being your eyes, nose, and mouth, being stuck by a sharp that stuck someone else, and remembering again that sharps are not necessarily needles, through IV drug use, through transfusion of infected blood or blood products, during sex from exposure to infected semen, vaginal fluids, or blood, from infected mother to her unborn child, or through breastfeeding, and from contact with that amniotic fluid of an infected mother. And I did want to mention the first one, blood being splashed onto broken skin or mucous membranes. If you'll just take a look down at your own hands, you'll notice that you've either picked at a cuticle, you've torn a fingernail, your hands are dry from too much washing. Any small cuts is considered a break in your skin barrier. So that's the broken skin that we're talking about. It doesn't necessarily mean a huge laceration going from one side of your hand to the other. Broken skin means all those tiny little cuts that are all over our hands. Just as in HIV, to prevent the spread of hepatitis B and hepatitis C, we know that the blood supply in the United States is safe, and we know to avoid high-risk behaviors. No IV drug use or sharing of needles, using safer sexual practices, abstinence and monogamy. But what hepatitis does afford us is the immunization against hepatitis B. We can also follow our safe work practices. And just as when we were discussing HIV, following safe work practices include practicing universal precautions and using the appropriate personal protective equipment that's made available to you. Hepatitis symptoms are divided into two categories, the initial phase and then what happens later. In the initial phase, it's categorized by general fatigue, joint, muscle pain, a loss of appetite. As with HIV, the initial phase of hepatitis appears just as a nonspecific illness. Later, symptoms include nausea and vomiting, diarrhea, constipation, fever, and again, those are pretty nonspecific illnesses. Jaundice is the hallmark symptom of hepatitis. It's a yellowing of the skin and the whites of the eyes, and is caused by a buildup of bilirubin in the blood. The buildup is related to the liver's inability to function normally. The risk of getting infections when exposed to a bloodborne pathogen depend on three things. One, the type of exposure, meaning parenteral, non-intact skin, mucous membrane, indirect contact. We'll talk about that in just a minute. Also, how much virus is in the blood or body fluid you're being exposed to, and the ability of the particular virus to cause infection. The different modes that I mentioned were parenteral, non-intact skin, mucous membrane, and indirect contact. So when we speak about parenteral exposure, we're talking about sharps. Parenteral exposure is when infected blood or infected body fluids are injected into the skin. Sharps are not necessarily needles, remember. Anything sharp enough to draw blood is considered a sharp. Some examples of parenteral exposure include accidental needle sticks, broken glass, wood slivers, drug use, piercings, and tattoos. Non-intact skin exposure occurs when gloves are not worn and hands are exposed to blood or body fluids. We have small cuts on our hands almost constantly from dry skin, torn cuticles, paper cuts. This is a break in our skin barrier and can allow infected blood or body fluids to enter our bodies. Mucous membrane exposure happens whenever blood or infected body fluid is splattered or rubbed onto mucous membranes. An example would be a crying child with a nosebleed, an uncovered sneeze with bloody mucus, or through our own carelessness when we rub dirty hands into our eyes, nose, or mouth. An indirect contact exposure happens as a result of us not being conscious of our own hands. For example, a student is sent to the restroom to clean up after a bloody nose. The student opens the door with their bloody hands, leaving blood on the door handle. We follow the student into the restroom, placing our hands in the same place, not thinking about where our hands have been. We rub our eyes or bite a nail without first washing our hands. So indirectly, we've placed someone else's blood or body fluids into our bodies. So now we know what's meant by the type of exposure. So how much virus is in the blood or body fluid you're exposed to? Well, that's just anyone's guess. It depends on the sick person's level of infection. It would depend on how long the body fluid has been on that surface, the temperature of the surroundings. The bottom line to this question is you just don't know. So let's move on to the ability of a particular virus to cause infection. If you receive the hepatitis B vaccine and develop immunity, your risk of contracting the hepatitis B virus is very small. The vaccine is 90% effective in providing protection against the hepatitis B virus. If you don't receive the hepatitis B vaccine, the risk of contracting the virus from an exposure is from 6 to 30%, depending on the amount of virus in the source. Well, again, we don't know what the amount of virus is in the source, so you can't depend on that being much of a help for you. Hepatitis C, the greatest risk of contracting is 1.8% or 18 out of 1,000. Again, those same barriers are in there, so you don't know how much virus is in what you've been exposed to. The risk of contracting the HIV from sharps or non-intact skin exposure is 1 in 300. Another way is 99.7% of sharps or non-intact skin exposure does not lead to infection. For mucous membrane exposure or indirect contact, the risk falls down to 0.1%. HIV is not a very hardy virus and doesn't live very long on just normal surfaces. But again, what we don't know, the variable we just don't know, is how much virus is in the blood or body fluid that you're cleaning up. So how do we protect ourselves? The way we're going to do it is universal precautions. We're going to treat everyone as though they're contagious, no matter how clean, how well dressed, how rich, how poor, how well we know their families, what neighborhood they live in. No matter who they are, we will treat their blood or body fluid as though it contains a bloodborne disease. So universal precautions. We will treat all blood as though it's infectious. Each and every time we give care, we'll follow basic universal precautions. Now, speaking of universal precautions, it's divided into 4 areas. The first being personal hygiene or good hand washing. 2, using the protective equipment that's been made available to you. 3, engineering or work practices or following those safe operating procedures. And 4, equipment cleaning or disinfecting. So hand washing. Employees should wash their hands before caring for students or between students, before leaving the first aid area, before eating or drinking or applying makeup or contact lenses, after removing gloves or other equipment, after touching contaminated objects, contact with wounds or body fluids, after visible contamination, but also after using an antiseptic towelette, also after using hand sanitizer, because there's going to be nothing better than hand washing. Hand washing is the single most important procedure in preventing the spread of infection, all kinds of infection, whether it's bacteria or viruses. It's the most frequently used step, along with gloves, preventing the spread of infection. So everyone knows how to wash their hands, but there's a few rules of thumb that bear repeating. Turn on the water, soap up your hands, vigorously rub your hands together, making sure to reach the backs of your hands and in between your fingers. Often today, soap is dispensed into our hands already foamed. This is not an invitation to not vigorously rub your hands together. Friction is required to remove the seen and unseen dirt from your hands. It's not the soap itself that cleans your hands, it's the soap combined with the friction. Rinse your hands under the running water, dry your hands with a paper towel, and then use the paper towel to turn the faucet off. If we turn the faucet off with our clean hands that we turned on with our dirty hands, we've inadvertently recontaminated our hands. The next section of universal precautions is protective equipment. Personal protective equipment must be used to prevent blood or other potentially infectious material from coming in contact with the employee's mucous membranes, skin, or clothing. Gaston County Schools will readily make available personal protective equipment at no charge to the employee. Latex-free options are available as well for those with latex allergies. You'll just need to know that, make your nurse aware if you have that latex allergy. So above you'll see some of the equipment options that are available to you. The type of equipment will vary with the task that needs to be done. You may have something that you only need gloves. You may need gloves to clean up a blood spill, or you might need to have shoe covers, aprons, a mask, eye protection. The level of equipment you need will depend on the task you have before you. It's the individual school's responsibility to maintain an adequate supply of protective equipment. Supplies may be ordered by submitting a supply requisition to the facility services supervisor, or a better way is just to contact your school nurse. She's an excellent resource to obtain the personal protective equipment that you need, that your job description dictates. That could include gloves, that could include CPR mouth shields. And speaking of gloves, they should be worn when there may be contact with blood or body fluids, any contaminated items or surfaces. Disposable gloves should be used only once and then replaced. Utility gloves can be cleaned with a disinfectant and reused, but utility gloves should be replaced if they're torn or punctured or showing other signs of deterioration like cracking or peeling. So now we've talked about personal hygiene and protective equipment. The next section is engineering and work practices, or how and what we use to clean up after and dispose of blood and body fluid spills. Biohazard waste cannot be disposed of in the same way regular trash can. It must be placed in the biohazard bag, and the bag, and in turn placed in the biohazard box. The boxes will be incinerated and not disposed of in the regular landfill. Now, it's your responsibility, just like with the manual and with gloves, to locate the biohazard box in your school. There might be several on your campus. If it's large and spread out, they're usually located in a custodial closet. But locate the box closest to your location so it can be accessed easily. Also, when it's close to being full, please notify your school nurse so she can have it replaced. Along with the biohazard bag, the biohazard signs will be used. You'll notice the sign affixed to containers of biohazard waste in full view, or at least close to the container as possible. Contaminated sharps should be disposed of in a sharps container. Sharps containers should be puncture resistant and leak proof, closable, color coded, easily accessible, maintained in an upright position, and not allowed to overflow and replaced routinely. Some important work practices to keep in mind: wash your hands with soap and water if gloves are worn or after possible contact with body fluids. Wear gloves every time contact with blood or body fluid is anticipated. Use your protective equipment kit if splattering or spurting blood might occur. This provides a clothes cover, a mask, face shield, shoe covers, everything you need to take care of a spill will be contained inside the protective equipment kits. The equipment kits are available in your custodial closets, in your nurses' offices. You should have one in your front office, and protective equipment kits are located on all school buses. Use the CPR mouth shield. Dispose of contaminated waste by placing it in a biohazard bag and then putting that bag into the biohazard box. All contaminated sharps should be placed in a sharps container. The fourth area of universal precautions is equipment cleaning and disinfecting. As it relates to housekeeping, trash cans, pails, buckets, and bins should be inspected and disinfected on a regularly scheduled plan, as well as immediately after there's contamination. One thing to keep in mind is a regularly scheduled plan at one school may be completely different at another school, so it's important to know at your particular school what that regularly scheduled plan means. Utility gloves shall be inspected for cracks or peelings or tears, punctures, or other signs of deterioration, and replace them if needed. If intact, they can be disinfected and reused. Work sites should be maintained in a clean and sanitary condition. Contaminated broken glass shouldn't be picked up with hands. Use tongs, forceps, or a brush and dustpan. Contaminated sharps should be disposed of in sharps containers or a puncture-proof container labeled with a biohazard sticker and then placed into the biohazard box. Contaminated work surfaces should be cleaned and decontaminated with an appropriate disinfectant after contact with blood or body fluids. Hard surfaces can be cleaned with liquid disinfectants. Carpets should be routinely cleaned, then sprayed with a disinfectant. Contaminated waste should be sprayed with the disinfectant and placed in a secure red biohazard bag, which then is placed in the biohazard box. Contaminated clothing or throw rugs should be sprayed with disinfectant, followed by routine laundering at 140 degrees. Cleaning and disinfecting as it relates to sports. Protective equipment cleanup kits should be available at all sporting events, as well as extra disposable gloves and plastic bags being a great idea. And don't forget those cleanup kits should be on all school buses. Wear disposable gloves when handling laundry. Uniforms and laundry soiled with blood or potentially infectious material should be sprayed with a disinfectant and placed in a plastic bag for laundering. Laundry should be washed at 140 degrees at the school site immediately. Sports equipment contaminated with blood or potentially infectious material shall be cleaned with a disinfectant prior to servicing and reusing. Open wounds must be covered prior to participation. Now, a bloodborne pathogen exposure incident. An exposure incident is a specific eye, mouth, or other mucous membrane, non-intact skin, or parenteral contact with blood or other potentially infectious materials that results from the performance of an employee's duty. Big, long definition to say whenever you've used good judgment in your personal protective equipment and have still gotten another potentially infectious blood or body fluid inside your body. It doesn't mean you've gotten another person's blood or body fluid on you, but that it's gotten into your body. Most exposure incidents can be prevented by using good judgment and universal precautions. Again, universal precautions is we're going to treat everyone as though their body fluids are contagious. Additionally, make sure that you have and use your personal protective equipment appropriately. Another help is your hepatitis B vaccine. It can prevent your body from contracting hepatitis B even if you're exposed. Remember, the vaccine offers 90% immunity. Even the best of circumstances happen. If an exposure incident occurs, promote bleeding if that's the appropriate thing to do. Wash the affected area with soap and water, or flush your mucous membranes if that's where the exposure occurred. If the exposure incident does occur, you'll need to report the incident to your principal or to your administrator. They will in turn complete the exposure report form that's found in their Bloodborne Pathogens Manual and consult with Human Resources. The paperwork's very important because it will be the paper trail that will help you get everything you need should an exposure incident occur. Now, the hepatitis B vaccine is a non-infectious synthetic vaccine. It's made from yeast and not at all from human blood products and offers, again, 90% effective protection against hepatitis B virus. The vaccine is a series of 3 injections given over a 6-month period. It's administered in the deltoid muscle of your upper arm. Side effects include local redness or soreness at the injection site and mild to moderate fever. Serious allergic allergic reactions are very rare. Classification 1 and 2 employees are offered the vaccine because of their risk of exposure to bloodborne pathogens in the performance of their duties. Pregnant women or nursing mothers should consult their physician before getting the immunization. Someone who's moderately or severely ill should wait till they're feeling better. There'll be no charge to the employee. If you choose to be vaccinated, you'll be given further instructions today, and if the vaccine is declined today, you may receive it in the future by contacting Human Resources.